Who doesn't love a great adventure? Recovery is best described as the best adventure of your life. The single most important predictor of long term recovery is the motivation of the patient. The addict must put recovery ahead of everything else in their lives. If they start to falter, slow, or stop aggressively working their program of recovery and putting ahead of everything else in their life, they will lose it and everything, often including their life. If they think their job and income is more important, that job and money will be lost with their next relapse. If they think that the relationship with spouse, children, parents, siblings, friends is more important, those important people in the life will also be leaving with the relapse followed by a failed recovery. Early recovery demands all of your attention. The patient in the intensive care unit needs to concentrate on getting better. Early recovery is like being in the ICU. When an ICU patient improves, they are transferred to a lower level of care in the hospital until they eventually improve enough that they're able to leave the hospital. Recovery is like that. Early, for at least the first year or so of recovery, and until the 12 steps are fully worked under the guidance of a good sponsor, the addict should consider themselves to be in the intensive care unit, the ICU, of early recovery. The ICU of recovery. Frequent 12-step meetings. 90 meetings in 90 days is recommended as a very bare minimum. Paying attention at those meetings, looking for the person who every time they share, the recovering person feels that he or she has what the addict really badly wants and needs. The purpose of the medications that we use in medication-assisted recovery and treatment is to enable the person to sit still in those meetings and to pay attention and not be going through active withdrawal, not have terrible cravings, not feel like they just got to go out and use right away. The purpose of the medications is not to cure or control the disease. The medications will not get you better. It's the meetings, it's the program, it's the steps, it's all of this that gets you better. The medication will only be one step in this big process. Frequent contact with other recovering people is essential. Doing what is recommended by others in the meetings. Choosing a sponsor, at least a temporary sponsor initially. Following your sponsor's advice completely and religiously, knowing full well that your sponsor is saving your life. Being totally honest. This will improve over time. The truth will come out like peeling the layers of an onion. This is actually a great mercy to us. We couldn't handle if all the truth came out all at once. The scrambled brain of an addict is just not ready for all of the truth. Total honesty. As Jack Nicholson famously said, you can't handle the truth. Early in recovery, it would completely overwhelm you. The truth will come out over time. Time takes time. Later in recovery, you will learn to balance your life and include family, friends, career, money, and integrate them all around your recovery program and your spiritual development. There's a lot to be said for having an addict take responsibility, financially and otherwise, for their own recovery. Perhaps giving it to the family member or employee as a gift the first time could be considered. After that, however, responsibility includes paying your own way. Those who are constantly being given everything have no skin in the game. Recovery is therefore worthless to the distorted mind of the addict. It didn't cost them anything, so there is no value to it. The second most important point to make, then, is that no matter how much you care for or love your addict, tough love may be the only thing that works. The addict must want to get better for themselves. The motivation of the individual is the only main requirement for successful recovery. Until the addict really wants it, recovery is impossible. The most expensive treatment center in the world can't make any difference until that addict wants it badly enough. And remember that Bill Wilson and Dr. Bob, the founders of AA, got better before there were any treatment programs. The addict cannot and will not get better for somebody else, no matter what the addict says. Remember, they're inherently dishonest. They'll say whatever they think you want to hear. Addiction is a disease of dishonesty and of self-will run riot, otherwise known as terminal selfishness. Recovery is a lot like sex. If you're not having a great time, you're not doing it right.
Mental. It'll take time for the distortions in the fog to clear. Comorbid dual diagnosis conditions need to be diagnosed and treated properly in the early phases of treatment. The diagnosis and need for treatment with medications may change through the course of recovery. Addiction mimics every mental illness. A prudent therapist won't give anybody a firm mental health diagnosis until at least of recovery, not merely abstinence is passed. Insanity. Repeating the same behavior expecting a different outcome. Albert Einstein came up with that one. The more time in recovery that passes while working the full program of recovery, the more socially, morally balanced and integrated we become. We will not regret our past nor wish to shut the door on it. Emotional. Feelings are not facts, and facts are not feelings. Addiction distorts and masks our emotions and feelings. Addicts frequently don't know what they're feeling. Many addicts don't fully understand what they're feeling at any given moment. Users typically done to take the pain away. This also numbs the normal natural feelings that we have. Feelings are neither good nor bad, they just are. Emotional growth appears to stop at the time of the initial use of the addictive substances. Think of a 30-year-old person with the emotional depth of a 15-year-old.
Spiritual. Those who choose to cultivate religious belief typically progress farther and faster in their recovery. They feel better sooner. Who wouldn't want that? Folks will often ask, "Boy, those 12 steps on that window shade look like a lot of work. How soon do I have to do that?" The answer is very simple. How soon do you want to feel better? Even the agnostic should consider this fact and reconsider their belief or lack thereof and become open-minded to change. As Einstein said, if what they're doing isn't working, perhaps they ought to reevaluate what they're doing and try something different. Remember that addiction is a me disease with a we solution. It's a simple but not easy program. It's only for those who want it, not for those who need it. Because of this, we cannot accomplish recovery alone. It requires the group dynamic. Always has, always will.
Addiction ravages the body. The exact organs damaged often depend on the substances and behaviors indulged in. Intravenous drug abusers increase the risk of HIV and hepatitis, liver inflammation, often viral, as well as heart infections. Alcohol damages virtually every organ and system in the body. Tobacco damages the lining of airways, lungs, and blood vessels. Complete cessation of abuse is absolutely crucial and mandatory for physical recovery. It's not uncommon for miraculous physical recovery to occur among those who work the full recovery program. Many treatment centers will ban smoking to stop all addictions in one treatment. This isn't done by all of them, is somewhat controversial, but is not a bad idea. The 12-step program is the backbone of all recovery programs. True recovery integrates, coordinates, and improves all of the domains. Medications can be used to assist, but they only assist in the recovery process. Medications treat the biologic, medical aspect of the bio-psychosocial, spiritual aspect of addiction. When dealing with addiction, which is truly a lethal, terminal, progressive disease, it's best to use every tool available, all simultaneously. Jails, institutions, and death are the ultimate and usually premature outcome of this cunning, baffling, powerful, ruthless, and lethal disease. Addiction truly is a terminal illness. Reasons for addiction continuation change over time, remember. Early, it feels good. Its use is impulsive. Later, it's a habit. It's compulsive. Finally, it's like dancing with that 800-pound gorilla. I hate it, and I can't stop because it hurts too much to try to stop. Pain is a very good thing, however. When what you're doing hurts more than the pain of the thought of changing, you will change. And until you really come to that conclusion and fully, truly decide for yourself that you want to change, change will not happen. That's why I repeat, the most important aspect for recovery to be successful is the motivation of the person seeking recovery. It's important to understand in this disease model that use, abuse of the drug or behavior is also only a symptom of the underlying problem. We use to feel better. That means there's something wrong with us. We don't feel good normally. Recovery gets us to feeling good normally. The behavior is just a coping mechanism to deal with this underlying feeling of dis-ease. Recovery entails fixing the problem at its root cause.
Recovery entails working the program of recovery. Recovery is a verb. Addiction has a few vitally important concepts. It's a me disease with a we solution. It's virtually impossible to get sober alone. With your distorted perceptions leading to your faulty choices, it's a simple but not easy solution. It's a simple program for complicated people. There's nothing wrong with asking for help on a huge and difficult task. Would you be reading this if you had gotten clean and sober by yourself? Repeating the same behavior while expecting a different outcome. Remember, Einstein defined that as being insane. It works if you work it, so work it 'cause you're worth it.